you. Further debate? Further debate, I recognize the Attorney General.
Thank you very much, Speaker. Thank you for recognizing me to speak on this motion, and most importantly, Speaker, to speak on the issue around mental health and wellness. I think, Speaker, it's a good day in this Parliament when we are talking about mental health and wellness. I think it's an issue we all recognize, and listening to some of the speakers speak from all parties, it's an issue that is near and dear to our hearts. It's near and dear to us personally, and most importantly, it's a need that we recognize is important for our respective communities. So I'm, Speaker, quite encouraged to see that we are having such an open conversation about the need for more investments in mental health and wellness. That is a good day for us as parliamentarians, and that is a good day for this province of Ontario when we, the elected representatives, are keen about discussing how we need to invest more in better mental health and wellness. Speaker, I've heard it said before in this House, and I want to repeat it, that there is no health without mental health. I think that's an appropriate sentiment to express. For far too long, our society, broadly speaking, have avoided talking about mental health. For far too long, Speaker, we have hidden conversations or our own personal plight around mental health to ourselves because we've been too scared to expose our vulnerabilities to others. We're quite comfortable, Speaker, talking about our physical challenges. If you get a broken arm, or if somebody's suffering from cancer or a heart disease, we somehow, as a society, are fairly comfortable to talk about that. But somehow mental health have not had that kind of exposure or comfort level. And I think we can all recognize in this House that all of us, as individuals, know people in our lives who have suffered from mental illness, or who may be suffering from mental illness. And I've been testing that theory, Speaker, by talking to a lot of people in my community about mental health and wellness. And it's incredible that when people open up, they tell you about themselves or others in their lives. Now, there has been the good side, Speaker, that I think there has been quite a bit of evolution in our understanding of mental health issues. We, as a society, have worked hard in breaking down the stigma around mental health. People are more and more comfortable in telling their stories or stories of their loved ones, and that is also a good thing. But the result of that is that not only we're facing the challenges around mental health, is that when you break down stigma, more people then will come out and seek help. And I think that is the time we live in, where more and more people are coming out, be it they're young or my age or older, coming out and seeking help for mental health and wellness. And that is why, Speaker, we have to invest in the system. Now, I am proud, Speaker, and as some of my colleagues have said, and I hope all members recognize, that we have invested new dollars in mental health. Since 2008, 10 billion more dollars have been invested into mental health system, and that is a good thing. But I think what I'm also hearing, which is fairly appropriate, that may just not be sufficient, that we may have to invest more money in mental health and wellness to meet the increasing demand, to meet the increasing awareness around treating mental health. But Speaker, I've been doing a lot of research into this area, and I've been talking to a lot of people. I want to particularly recognize the Royal Ottawa Mental Health Centre that is located in my community of Ottawa Centre for the opportunity to engage me and have conversations. I want to thank the soon-to-be outgoing CEO and President George Weber, who's done an incredible job with Royal Ottawa, Nicole Laredo, who's the VP of Community Relations, people like Dr. Raj Batla and Dr. Zul Mirali, who are doing some leading edge research and work into mental health. And the conversation with them and other community partners that I've been engaged in is to understand, as we look into investing new dollars, as this motion is suggesting, and I think we think that we need more money than what's suggested in motion, and I don't think, again, that's a negative thing. That's okay to acknowledge. As we look into investing new dollars, is it just okay to just throw more money in the system, or do we need to do something more comprehensive? And I think my colleague and friend, Minister of Children and Youth Services, was talking exactly about that. What we need is a different and more comprehensive approach to dealing with mental health and wellness. That will require new money. That will require far more dollars. We think it will require more than $1.9 billion over 10 years. But I think that's the system-wide approach and conversation that we need to know. We need to engage in. We need to build a system that not only is available for somebody who's very young and starts experiencing mental health issues because of bullying or other reasons, and then making sure that it works through the entire system, through the entire spectrum. The analogy, Speaker, that I use is like primary health care. You know, we recognize at some point that in order for us to live in a healthy society and be able to be healthy personally, we need to invest in prevention. And investing in prevention meant investing in primary health care, making sure that people have access to a family doctor or a nurse practitioner or a community health center so that they can look after themselves. I am of the belief, and I've been advised by experts in the area, Speaker, that's exactly the kind of system that we need. It's almost that we need mental health care services at a primary health care level, be it through our primary health care provider, like our doctors or nurse practitioners or community health center, or at a community setting. But we need to make sure that when people, especially starting young, when they need access to mental health, that those services are available, be it in our schools or at a community setting or through our doctor. And that's the investment. That's the system that needs to be created so it is comprehensive, and there are points of intersection in that system based on your need available through the system. Not to mention, to overlay that, to keep in mind the diversity of this great province, right? So we need to make sure the north and south, the urban and the rural is all covered as well. So the services are not just congregated in in urban communities, as sometimes the case may be, that they're available everywhere across the province. So that is another important overlay on creating that system-wide approach. And the other thing, lastly, I want to say, Speaker, that we need to make sure that there's continuum of care, so that you've got people, different people who are able to provide services depending on a need. So it could be a social worker, it could be a youth worker, it could be, Speaker, a psychotherapist, or a psychologist, a psychiatrist. Depending on your need, you need capacity in the system that can address those different issues. But I fundamentally believe that we need new dollars and new investments, and I think there is a consensus there, and we need to make sure that we're bringing a comprehensive system. So thank you very much, Speaker.